Oh, hi, my name's Dr. Jo Watson and I'm a Senior Lecturer in the Disability and Inclusion team here in the School of Health and Social Development in the Faculty of Health at Deakin. That's a mouthful, isn't it? Now, our team is led by Associate Professor Angela Jew, and I'll tell you a little bit more about Angela's research a little bit later on. I'm based on our Melbourne Burwood campus, which is located on the unceded land of the Wurundjeri people. We also have team members, and I'll tell you about them as well later on, who are based on the Geelong Waterfront campus, which is also located on unceded land and of the Wutherong people. Now, my role in the team is to direct our postgraduate suite of courses in disability and inclusion. And as a member of the Institute for Health Transformation, I also engage in a lot of research, as do my wonderful colleagues in the disability and inclusion team. So let me tell you a little bit about our team. Our team is diverse in terms of who we are and what we bring to our research. That diversity exists in our professional backgrounds, but also around our lived experience of disability. But what we have in common is our commitment to the principles of inclusion and participation. And that is reflected in everything we do, whether that's our teaching, our engagement with the community, or our research. And we do this by working alongside people with disability from a diverse range of backgrounds to ensure that the perspectives of people with disability are the key drivers of all our research activities. So they are at the centre of all our research. We have strong connections with people with disabilities and the broader disability community who we work with to identify areas of research that will inform a human rights approach to disability and inclusion. As researchers, we're constantly finding new ways to develop inclusive practices and outcomes for everyone, with the aim to create more informed society about the barriers that really still do exist for people with disability in our society. So I'll talk a little bit about my research and then I'll give you an overview of the research of some of my colleagues. My research is primarily focused on the realisation of human rights for some of the most marginalised people in our society. So they're people with profound and multiple intellectual disability, and they don't use speech to communicate, and they've traditionally been denied their human right to autonomy. I've practiced as a speech pathologist for over 30 years, and one of my frustrations is that this group of people are rarely heard in research. So that means we know little about their lives, and it is this frustration that's led me to focus my research career in this area. This fundamental human right to autonomy is mandated by Article 12 of the United Nations Convention on the Rights of Persons with Disability, and that is core to my work. Through my research, I've developed a growing evidence base for supporting people with profound and multiple intellectual disability to have their will and preference acknowledged and interpreted and then acted upon, and by so doing, realising their right to autonomy. So in terms of some of the projects that I've engaged with over the last few years, I've looked at palliative care and end-of-life care for people with intellectual disability and complex communication support needs. And I've recently worked with a student from the Netherlands who worked with me to interview some health professionals around attitudes toward palliative care for this often overlooked group of people. And this work stemmed from our practice and our anecdotal reports about people with severe and profound intellectual disability not having access to palliative care services. So that's one area of research, an example of research that I engage in. Supported decision making is another one. And this is where we have a body of research where we look to find alternatives to guardianship for people with cognitive disability. And the notion of personhood is another area, and we often look at how personhood is understood by society, particularly again for people with severe cognitive disability. The impact of smart home technology is another project that I've recently been involved in, and it might be of interest to some students. So how do smart homes impact the lives in terms of self-determination and quality of life of people with severe intellectual disability? Another area, my background is in speech pathology, so I have an interest in oral health for people with intellectual disability, and this is an area that is often overlooked for people with intellectual disability. So we have a large consortium of researchers and practitioners and dentists from all over Australia, where we're looking at a range of issues in that area. So that might be an area that people might be interested in talking to us about. The impact of the COVID pandemic on people with intellectual disability is clearly an area of interest for us, and it is something that our team has been very much involved in around a couple of projects, and we'd love to have students involved in those. We're exploring the experiences of people with disability during the COVID pandemic. We have a grant that's been led by Dr. Kate Anderson around the public health information that has been provided to people with disability living in residential services. We're also, Dr. Helena Jenkins and I are supervising a student at the moment who is looking at the impact of the COVID pandemic on people with disability who are homeless in New York City. She's actually based in New York, so she's not doing that research from here. Circles of support is another area of interest of ours as a mechanism for supporting people with disability to live autonomous lives. Associate Professor Angela Dew and I are involved in several projects exploring the impact of circles of support for people with intellectual disability and complex communication and support needs in terms of their relationships, their social capital, independence, and a number of other variables. So that's another area that you might be interested in. Now, I'll tell you a little bit about the research of some of my colleagues. Dr. Amy O'Shea is doing some wonderful work and has a world-renowned reputation in the area of sexuality for people with disability. And I'm sure she'd be happy to talk to you about her project. As she says to me often, sex sells. So come and talk to her about some of her research experiences with people with disability, particularly around the intersectional experiences of people who are LGBTIQA+, and also have a disability. An example of a recent project one of her students has led is the co-development and appraisal of information for people who are LGBTIQA+ and have an intellectual disability. The goal was to use a participatory action research approach to co-design informational material and to evaluate its value within the community that they have been developed for. So Amy is also a trained Auslan interpreter and therefore has a personal and academic interest in supporting people who are deaf and hard of hearing. So if you're interested in any of those topics, she'd be really pleased to have a chat. Dr. Helena Jenkins has a strong background in international development, and she's particularly interested in exploring the intersectional discrimination that people with disability from developing countries experience. Her work is strongly embedded in international human rights legislation, so the UNCRPD that I mentioned before, and practice. And she has very strong connections, particularly in the Pacific. So another very interesting area. Helena is also a foster carer and so has a personal and academic interest in the experiences of children with disability in out-of-home care. And like Amy, she's also a Auslan interpreter and therefore has a personal and academic interest in supporting people who are deaf and hard of hearing. Now, our brave leader, Associate Professor Angela Dew, has a strong research background in supporting people with complex needs to participate in individualised support planning. She works with people who often fall through the gaps of services, and she has a very strong participatory approach to her research and uses a range of innovative methods, including art-based approaches, so that's very exciting. She works a lot with Indigenous and Torres Strait Islander communities and has done a lot of research in that area. She's also involved in projects focused on people with disability from refugee backgrounds and is particularly interested in talking to students who might be interested in exploring some projects with her around that area. Now, Dr. Kevin Murfitt is someone who's been with our team probably longer than anyone. He has a strong reputation in research around employment of people with disability. Like all of us, his research is strongly focused on international human rights law, particularly the United Nations Convention on the Rights of Persons with Disabilities. Kevin brings a wealth of academic and lived experience to the team. Dr. Kate Anderson, like me, has a professional background in speech pathology, and she has a strong focus on exploratory work in virtual reality, telepractice and universal design, as well as the translation of information to those who really need it. So she looks at how information becomes meaningful for people. Recently, we had a student focus on the role of disability support officers in schools with a view to understanding how their role can impact social inclusion for kids with disability. So that was a recent honours project that I co-supervised with Kate. Another of Kate and Angela's students has recently focused on the role of Beyond Blue for pre-service teachers in understanding mental health issues for their students. And another of Kate and Kevin's students has focused on transition to retirement for adults with intellectual disability. So you can see as a team we are very happy to support students in developing and conducting a range of unique projects that really interest them. We're really happy to work with you to explore what's going to be most meaningful to you within the field of disability and inclusion. We want your research training to really be relevant and of interest to you. We would be delighted to talk to any students who are interested in exploring research in any of the areas I've mentioned above or even beyond. Importantly, we're particularly interested in exploring students' in genuine interest in building their skills in a participatory way alongside people with disability. So thank you very much. It's been lovely to talk to you, and please let us know if you'd like to do some research with us.